Okay. First of all, Dr. Sanika, a big congratulations that you have
Thank
passed. And as I said to you multiple times, that I didn't have any doubt that you're going to pass this exam because you are my finest army. Okay. And I said to you just before your maybe 5 days or 6 days of the exam that you are going to pass your exam. That's for sure. But what you are going to do right now to secure the the highest score of the MRCS. So that's what you are reading. That's what you are working for. So without that, if you don't study at all, a single word, a single thing, you're going to pass this exam. So yeah, so I made a promise and I keep my promise as well. Okay, so now it's your turn. Just tell us whatever you had gone through, whatever the things you did for this exam, and like just everything. Just share your experience with us. We'll be delighted to hear from you.
thank you. First of all, being here has been the
Yeah.
dream, the dream, because I remember since I joined IMG, I attended each and every this session, Hall of Fame session. And every time I told Krish, I told Dr. Atik that one day I'm going to be here. For Krish, I used to say one day we are going to be here. We are definitely going to be here. And today is that day. So I'm really thankful to God, thankful to all the people who have helped me. There have been many, many. I talk to lots of people a day. So there have been really many who have guided me. But first of all, for Part B journey, the booking started after my Part A exam. The booking was very forceful for me, very forceful, because we got our result. Me and Krish congratulated each other. And then he calls me again. Are Mumbai seats are there, Sanika, let's book. I'm like, now? Yes, now. And he's like, yes, chill, let's book. Call your papa and let's book. I'm telling him, no, wait. Let's wait. No, I have to talk. I have to think. When is it? He's like, December. We have lots of time. Our result came in June, back in June. He's like, December. We have lots of time. I told him, bro, you're going to go to Goa now. When are you going to study? Nee, don't think about me. Let's book. We have to do it in Mumbai. That's how he forced me to book it. And then I was clueless. Then I was thinking, what am I supposed to do? I mean, I know the notes, but when I read it, it gives me migraine because unless and until you understand it, unless and until you know how to speak it, unless and until you be confident with stuff, how are you going to go and give the exam? You cannot. So I started speaking to Dr. Atik over text. Surprisingly, our frequencies matched, and one day he decides to call me. We had the longest call, and it wasn't only related to MRCS, it was related to lots of other things. And then I got to know that no, maybe I should go with Dr. Atik. Yes, because he's promising me lots of things. I should go. And somewhere there is an intuition, right? You feel it that no, this is something. So I just followed it blindly. I followed it. I made others follow it. Like I took Krish also with me in it. He's like, Sanika, have you even thought about it? Why? We were going to discuss. I'm like, no, wait. I think we should go for this. I definitely think we should go for this. So he also joined. He joined a bit late. So he was trying to cover up things that I was ahead. So while I joined, I remember in the beginning only, it was my first patho class, but it was the
Yeah.
last in the schedule.
Right.
So I remember I was asking you questions about it. I was like, I don't understand. I joined, but I don't understand what is it. So you told me that no, don't worry, it is the last class of patho. How will you understand? So it's okay. Oh, not patho, critical care. Critical care
Critical care.
last,
Yeah.
yeah,
Yeah.
critical care. It
You
was the
had the
poly.
entire patho.
Yes, I had the entire patho.
Yeah.
For patho, oh my God. I mean, it was my first course for Part B. I wrote every word that Dr. Atik told. Every word from all the cells to how it happens to what tumor markers to what is the treatment, everything. And that's how I performed in the mocks. I made sure to participate in each and every mock. That is very important because even though how doesn't matter how well you speak, how well you can handle things, but in the exam, it's a totally different thing. You don't know that side of you that comes out in the exam. In the exam, you face a different you. So, in order to be able to handle that part of you, you have to constantly go through uncomfortable phases. And mocks are one of those uncomfortable phases because you are first of all studying for the mock, then you are answering to random questions, and third of all, you are thinking about the mistakes that, okay, I made this mistake, so I should work on it. So there are three steps: studying for it, giving the mock, and thinking about the mistakes. I did that for Patho. And even though Dr. Atik said that Patho you can leave behind, but I was very focused upon doing everything. I was like, I have joined this and I am going to do all the things. And that's what I told others also. But I agree, everyone cannot do everything. But whenever everyone came to me, I used to be like, no, no, this is also important. No, no, that is also important, and everything. So Patho finished. And then when skills started, that was one of my favorite parts because I could be me. I used to talk and try to become a very cranky actor. I remember I scared one of the colleagues during one of the mocks.
Yeah.
During communication, being the anxious mother, I started crying, and then I was like, "Give me a tissue, give me a tissue," and I could see everyone is laughing on the chat box over there. And then, he gave me a tissue, and then I started crying again. Then he's like, "Tissue box for you, ma'am." He gives you the whole box. And then it was like I tried to make it interesting, not only for me, but for others also. Because unless and until you make it interesting, it's not going to work. You cannot study when you're bored, because when you're bored, you'll not feel like studying. So I tried to make it interesting. And then obviously the study partner thing. Very important role, very important role. I cannot tell you how many times I have scolded Krish and he has scolded me for things. I mean, in the beginning, we took it slow, like, okay, topic by topic. Then we started mixing it up that, okay, knowledge will mix few things, and skills will mix a few things. And then we mixed both together, like knowledge and skills. We had a pattern and we had made it really hectic towards the end. So since it was hectic, we couldn't study everything, but we used to still ask each other that, okay, you didn't study everything, no problem, but I'm still going to ask you. Let's see how much you remember, especially in the skills part, because skills you cannot mug up. You have to practice. So we turned on the video camera. He's seeing me, I'm seeing him. We are practicing everything. Now the sutures that I'm placing, he's like, no, no, show me how are you placing this? Show me. I should take the camera close. That see, this is how I'm placing it. He's like, no, 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 this is not like that. Do it like this, do it like that. So we had lots of brainstorming sessions, and that's what you need for your practice. Unless and until you practice it with someone who is giving the same exam, obviously if you do it with your relatives and stuff, they are going to be very lenient. They'll not be able to assess you as much. So someone who's giving the exam, and it will be even more better if it's in the same center on the same date. But then practicing is very important, because when you practice, that's when you understand what mistakes you can make and what mistakes you're bound to make, and how can you improve. Improvement was a thing for us. We wanted to improve again and again. About the notes, I'm not saying anything because obviously everyone has said it. It was all the same. A few questions will always be from here and there, but it's okay. You have to, Dr. Atik told me this, enter with a smile, greet everyone nicely, show that you're confident. That is all you need. So I entered. I got a migraine during my exam. During my fourth station, I had a migraine. During the break, I went to Krish. I put my head on his shoulder because I was dying of migraine. And he thought I'm joking. So he's like, Arey, what are you doing? I'm like, I'm having a very bad headache. So even with that, my main goal was to keep a smile. So I forgot my headache. I went in the next station. With a smile, I entered. And when I smiled, they also smiled. They were also obviously tired. Towards the end, they were tired.
It's
So
a positive energy you are sharing,
yes,
right? Yeah,
you take the aura with you. You enter and there
exactly.
is a aura. So they were very nice to me, all the examiners except one examiner, but it's okay. Such examiners come. There are some examiners who maybe don't know the pattern, or maybe who want to take some turn or something. But that's fine. 1, 2 stations, 3 stations won't affect. One of the biggest mistakes that I made, which no one was expecting me to do, was washing hands. I did not wash my hands because my first station was a spine station. It was a very big stem. And I read it and I was very overwhelmed. I was thinking that, oh my God, such a big stem. Am I going to remember this stem? Then I went inside. The examiner was sitting like this. The sanitizer was on the opposite side, like touching the wall. I forgot. And then I started with the patient. I just greeted him. Professionalism and everything, I did whatever Dr. Atik told me. He told me point by point. That's how I followed in the mocks. And this was just another mock for me. Just that there was another examiner, not Dr. Atik. So that is how I took it. Second station, I again forgot to wash my hands. Did it affect me? Yes, it affected me because I was thinking that, oh, Sanika, you did not wash your hands. You did not wash your hands. And then the second station examiner was also over friendly. He wanted to talk to me a lot. He was like, hi, Dr. Sanika, I am Dr. This. This is your patient. His name is this. And you are supposed to do this examination on him. You have these many minutes. You can calculate the amount of time he wasted for me. He wasted that much time. And I had diabetic foot examination. I had to do the whole top cars and everything. So, but it's okay. Even though he did that, I tried to do the most important stuff that I could do. And I finished it. And then the third skill station, the examination station, I got out of my second station. I just stood there. I was clapping my hand. Sanika, you have to wash your hands this time. You have to. Even if there is no sanitizer, just act to wash your hands because you cannot forget it. You're losing one mark. You cannot do that. So that's what I did. I entered, I washed my hands, and then I started with the other things that was in a row, step by step. I did not try to make it robotic. I just went with the flow. How did this flow develop? It is not something that I had from before inside me. In the beginning, my first clinical examination mock station was very much long. Dr. Atik took some station for me and it was very long and I was trying to explain everything. So he told me, no, Sanika, you cannot explain everything. You have to make it short. So that's how I worked on it. And believe me, it wasn't just in one night or 1 week or 1 month. It took me from June to December. So, and with absolutely no time pass days, no breaks, nothing, because that's how bad I wanted it. And MRCS was always the dream. So you have to work for it. If you want something, you have to work for it. It is not that, okay, fine, I'll read for 1 month and I'll go and I'll give it. Some people are very smart. They can take everything in one go and they can go. But it doesn't work for everyone. So why risk it? If you have the time, even if you don't feel like it, just study it and get a partner. He will motivate you. Like my partner did. Like rather, I was motivating him, I think, more than he was motivating me. But yes,
All right. Dr. Sanika, can you share your score with us?
281. But when I saw my score, I thought I've scored very less. I thought that, oh, I scored only 281.
What you expected? 300?
She was
Without washing
expecting
your hands?
340. She was expecting 340.
Yeah, without washing the hand.
And,
Without washing my hands, yes.
Yeah. All right.
and the
So,
first thing when we were calling, when we got our result, like, please, Sanika, don't say that we got the same marks because this happened like in part A with us. So I said, please don't say it like we got the same mark this time. But I'm happy that she got really nice marks.
yeah. Okay. Dr. Sanika, it's very, very nice. Like, it feels from my side, it feels very nice. Like when I'm saying something and it is happening, right? So I had that faith in you, like that she's going to pass it, and I knew it from my heart that you're going to pass this exam. So, and you had it right now. So it's a feeling of like unexpressible joy. You cannot share that with the expressions and all that stuff. So now you are in a phase of like you are still giving so much for the candidates whoever want to know about the MRCS and all that stuff. You are still like sharing everything, and from now on you have to be like helping the other candidates more and more and more and more, right? Okay, this excellent, like what you did and what you are going to do in next like in coming days and everything. It will be like excellent, of course. Thank you so much for being here and sharing your experience. And I was thinking, like, back in my head, I was thinking you are going to cry. Okay.
I have
But,
controlled a
but
lot. I mean,
yeah,
my eyes are teary, but I've
yeah.
controlled a
So
lot.
the thing is, you couldn't do that because of the craze. Okay. What we had the conversation just before that, because of that, you couldn't do it. Right. So
Yes,
yeah, that's good.
that made me laugh actually,
Yes,
because he was
that's good.
saying some things. That's why I was like, ah, really? Oh, really? You
Yeah,
did that? Acha, acha, okay.
right. So, all right. So I want to know any one of you have any queries, any questions. You can ask me, Dr. Sanika, or whoever you want to ask. If you have any queries, please speak up. Come on, guys. Like it's about the communication, you know. You have to share, you have to talk. Until or unless you are going to talk, you are not going to pass your exam. That's for sure. So like this is a platform, this is a thing that where you can talk, right? So just go for it. All right, so we are going to take the question from Dr. Kazim. Dr. Kazim, you can talk, you can ask the question to Dr. Sanika, no problem.
All right, good evening, everyone. Thank
Hi.
you very much for
Sorry, I'm not able to hear you.
experiences.
Dr.
Right, so
Kazim,
I just wanted to ask, I want to take my exam in Peru. Can you hear me now? I
It's very
want to
cracking.
take my exam in May, and can you hear me now?
Now, yes.
Hello?
Yes, now better.
Can you hear me?
is it possible
How
for
about
you?
now? Can you guys
Maybe
hear
you
me
can
now?
type. If you are
Yeah,
able to hear me, then you can type, I'll answer.
Hello?
Dr. Kazim, can
Okay,
you
so I
just
want to
type?
take my exam in May, and I just started preparing, and I'm not sure if I'm fit enough. I just want to know if I don't really right. Okay, I'll type
Okay.
out. I'm typing already.
Yeah,
Okay,
yeah,
okay.
go ahead. I think what Dr. Kazim wants to say is he want to take the exam in May. Yes, exactly. So does he is having the enough time or not? Yeah.
Of course you have. You have February, March, April. Just work day and night. Fine, you will get it. Yes. Nothing is impossible. Be very optimistic. Think that you have already gotten it. I remember this one story that during our history taking, we just finished our history taking cycle. And Dr. Atik calls me one day and he gives me a stem. And he's like, okay, take your pen and paper. And I'm like, but, but why? I haven't studied anything. Then he's like, no, no, just try. And I tried it. And he was like, Sanika, you're already passing. What? I mean, you did so well now, and you have exam after so many months, and you are doing so well. So I was saying that really, is it nice? So he was like, yeah, yeah. So that these small things were like a boost of confidence for me. I mean, knowingly, unknowingly, there are some people who influence you a lot, and lots of my colleagues have been that way. Dr. Atik though has been a mentor only. I tell my parents that, oh, my mentor is calling. Wait, wait. I'll talk to you later. That's all right. He messaged me, are your results out? And I was like, yes, 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 it's out, it's out. And I couldn't wait to call him back. That yes, I've passed because I've been waiting to tell him this. Since I started my journey with him, he used to always say that, yeah, you're going to pass, you're going to pass. But I did some stupid mistakes in the exam. And I was like, oh shit, how badly have I disappointed Dr. Atik? I told this to Aditya, I told this to Krish that, what, yaar, when I told Dr. Atik that I haven't washed my hands, he sounded so disappointed. What am I supposed to do? You were like, chill, Sanika. You must have scored very good. I was like, no, but washing hands like this. So don't worry, Dr. Kazim. 3 months are more than enough. 3 months are you can get higher than me. Don't
Dr.
worry.
Sanika, I want to say you a funny story. So we had one candidate. I cannot recall her name right now. So she did the same mistake. You know, uh, she
Hmm.
she did the same mistake. She didn't wash her hands.
Dr.
Okay,
Uma. Dr.
Uma,
Uma.
Uma.
Yes,
Uma.
exactly
Yes,
right.
yes.
Thank you, Dr. Uma. So what she did just after the exam, she called me and she was like saying, sir, I didn't wash my hand. Am I going to pass? I didn't wash my hand in the three stations, not in a single station. I didn't wash my hand. I didn't wash my hand. Am I going to pass this exam? And like I said, okay, just go to your house, okay, take some rest. And after like tonight, tomorrow, I'm going to call you and I'm going to talk with you about this. And the next morning, she started to call me again. Like, sir, just now, no, tell me. Okay, tell me, am I going to pass this exam or not? I didn't wash my hand 3 times. Okay, so I just patiently, I heard all the stations, station by station, and then I said, like, Dr. Uma, you're going to pass this exam. Don't worry. And you know what? She also got like so like very high mark. I think she got almost 270 or 260 or something like
Wow.
this, or like it was very high, right? So the thing is now I think whoever is going to forget about washing the hands, they're going to have the very high score. I think so.
I also forgot to wash my hands in 2 stations.
Dr.
Yeah,
I forgot to wash my hands.
yeah, Dr. Akshata,
Yeah,
what is
lie down, sit. It's
what is your score? I think 263 or something like that.
6.
266. See? See?
Yes. I made a hernia patient lie down, stand up, 2 3 times, but every time again,
They made a hernia patient lie down and stand up. Dr. Akshata, there is some robotic sound coming from your mic.
Yeah, I was thinking why Dr. Akshata has become robot after passing the MRCS. Dr. Akshata, there is some network issues, I guess. So we will take next question from Dr. Samreen. Dr. Samreen.
Hello, sir.
Yes,
First of all, many congratulations to all the candidates, past candidates. Actually,
yes,
my
I am
question is,
overwhelmed, Dr. Samreen. I am really overwhelmed. Like, what's happening? That's excellent.
yeah, mashallah.
Yes,
So, sir,
alhamdulillah.
my question is with you or with all the past candidates. I'm going to appear in the May attempt in UK center. So many people scared me like in why you booked for UK center and you will get so many news stations there and you will get surprise and all that. So I just want to ask you, is it so, or we'll going to get the same stations what we are reading in our notes and what has been previously in the recalls and the past papers? So
Okay.
yeah,
So
this
the
is my
thing is, it is true. If there is a news station that will come first in UK, okay, that's for sure.
okay, sir.
That's for sure. And if the artists will see, like, if it is working very nice, if the majority of the candidates is quick, doing good on that station, then this station will be diffused in the other parts of the world. Okay, just like suppose I'm going to give you an example, like
Actually, no,
post-operative
my
THR in case of post-operative THR in case of history taking. Okay, so it started in UK first, then it went well. Okay, and then now it is coming all over the world again and again and again, right? So that's how it started. So it's true that if there is a new station, they're going to start that in UK center. Okay, Dr. Samrin, that's for sure. All right, now
okay, sir.
it doesn't mean that you have to be get frightened. It's new for you and all of your other like 17 or 20 participants as well, right?
Okay, sir.
So it's nothing like
Yes,
that
sir.
you don't know, but the other participants or the candidates know about that station, right? So it's the same for the other people as well. It will be new for them, correct?
Yes, sir.
So now,
Yeah.
if the total marking is 20, if you're going to get the 10 out of the 20, all the other candidates is going to have the 10. It's the same, correct? So failing
Okay.
of the new stations doesn't work here. So what you have to work for is whatever you have in your hands right now. Okay. So you have to be focused on whatever you have gone through, whatever the stations we have like gone through. You have to be focused on those things. Okay. And
Okay.
most importantly, if you're going to give your exam in UK, that means you have to be very, very strong in the skill part. Okay. You're going to pass your exam,
Yes.
the knowledge part, no problem. But in the skill part, you have to be like, very good at it, specifically for the UK center. That's you have to keep in your mind that you have to be very, very skillful in your skill part. Okay.
Okay, sir. Okay, sir. Thank you so much. Thank you so
All right.
much.
Dr. Sanigi, you want to say something about this?
Yeah, no, See, even if they release news stations, they are not going to release like 4 or 5 news stations. It's going to be maybe 1 or 2. So
Correct.
you have to keep polishing yourself. I mean, polish yourself in other stations, and even suppose they are giving you a new clinical examination station. Okay, it's new for you.
Okay.
You have never done that. The basic steps are the golden rules are going to be the same. You
Yeah.
are going to top in your professionalism. Get the marks that you can get easily. Other things are fine. Like while presenting,
Yes.
also, none of my examiners were focused on what findings I was giving them. They were more focused on how am I presenting? How am I looking at them in the eyes? How am I sitting? How calm am I? Am I moving my fingers a lot, or am I agitated, or what? How did I treat my patient? Have I, like, I remember vividly that when I entered, when I introduced, told my role, did not wash my hands. Other things like exposure, pain, and making the patient comfortable, walking, trying to walk around the patient. He gave me tick, 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 tick. Like it was done. Half the paper was ticked only with those things.
Okay.
So it is that good.
One
Yeah.
secret, one secret, and the biggest tips for all of you are present here and who will be hearing these recordings in the future is you have to be safe for the patient. Okay. So the RCS is going to judge you whether you are safe for their patient or not. Okay. So when they will understand that this doctor is safe for our patient, then they are going to make you pass. Okay. So you have to be safe. And that's why we always involve the different types of consultants for our further treatment. Always we show the empathy. We always ask for the pain in the skill part. We always think about the patient first, then ourselves, right? So we need to know that this patient is safe. Okay, that's their first priority. Okay, so you have to become like that. You are a safe doctor. You are a safe person who are going to give the treatment for this patient. Okay, and when you will become a safe person who are going to give the treatment for the patient, the RCS will make you pass no matter what. I hope you get my answer, Dr. Samrin.
Yeah. Thank you so much, sir.
All
I
right,
got
no
the answer.
problem.
Thank
And
you.
that is very true because the in the procedural skills station they were very focused on how am I handling my sharps
Yeah.
and how am I communicating. Basically, in procedural, all the future candidates who are going to give the exam, don't be shy to ask for stuff. Enter, the station is yours. Dr. Atik told me that, Sanika, it's your stage. You're so good at acting. It's your stage. Go and just ace
Yeah.
it. So that's what I thought. Like I entered and I was like, okay, I am like, it's my normal duty. I entered. I was like, do I have an assistant? So the examiner also was very good. So he was like, yeah, there is an assistant. He's here. So I was like, hello, nice to meet you. So you're going to help me out with stuff. Am I right? So he was like, yeah. And then the same golden rules, whatever was there. So the sharps and everything, I asked them, where can I dispose them? So you have to have a presence of mind. For a presence of mind, you need to have a good sleep before the exam. One day before the exam, I remember me and Krish spoke over call. We did not want to leave the call. Like we just were on the call and you're like looking at each other that, okay,
Yes.
tomorrow is the day.
Exactly.
Tomorrow it's finally here. I mean, he's just sitting there. I am just sitting here. We are not talking. We are just thinking that, okay, how
Just
is tomorrow going
motivating
to
each other. Yeah, just motivating each other by just looking. No words
just try.
spoken at that time. Yeah.
Yeah. We just thought that, okay, let's revise the most
Mm,
important things. So we did say a lot of things. Maybe we forgot most of the things, but that doesn't matter. At the end, what matters is that you are calm throughout your exam. Calmness is super important because there are going to be breaks in between the exam. Maybe you will have some problems, like I had the migraine issue. There can be any obstacles, but how are you going to tackle them? How are you going to dodge through them? That's the most important thing.
Stress
yes,
is
be
your only
confident.
enemy.
Yes, yes, be confident in the exam because they are going to look at each and every movements of your hands, your facial expressions, how you're handling the patient. If he asks you some different question, if he asks you some out of the box question, they are going to judge you. So, just calm yourself down and just be confident. Like you know the thing, you are the king. You know everything about it. And if you are telling any wrong answer, speak in a confident way. Like in the end, I'm not saying in the beginning. in the end, when you are saying like, okay, I will get back to it later, and still you are not remembering, the answer. So just in a confident way, don't try to, utter in a low pitch speech. So confidence, I found it out that confidence is the key for the exam and the pattern.
And for the
That's it. You
confidence,
will,
everyone has to speak. Everyone has to
yes.
communicate. I remember that during these Hall of Fame sessions, even though my doubt was like the silliest doubt, I used to talk to all the candidates that, yeah, because I have to talk, you have to communicate. That's why I used to talk to so many of you to help you guys. But because I wanted to improve my skills, that was obviously to help you, but that was improving my skills as well. And unless and until you talk, unless and until you work like on the skills, not tying. Oh my God, I had the knot tying station. First of all, I did not undergo any this thing hands-on course. No hands-on course. I was totally
Only
dependent
the
on Dr.
hybrid.
Atik. Yes, the hybrid. Which Dr. Atik, I know he made it specially for me because
Yeah.
he was supposed to do it a bit slowly, but then I told
But
him that
I'm a man of my own word. Like,
yeah.
so I had promised you, Dr. Chris, that I'm going to go in India and doing the hands-on and all that stuff, right? So I couldn't do that. So I had that like problem in my head that I have to do something for these 2% at least because I have promised them. So what I can do, right? So that's why I just did that hybrid workshop for all of you guys who are not able to join the live workshop in Bangladesh. So I had to do that. Yeah.
And that is super helpful. No other course has it. And no one
Was
will
helpful.
explain you like the way the videos are. The videos are exactly how you're supposed to perform in the exam. Every procedural skill from every equipment that you will have, everything was there. I saw the same things in the exam and I was super confident about the knot tying. The way Dr. Atik said, I did the same thing. The examiner also was very happy. I remember the way in the deep knot tying at depth one, I was pushing it and the examiner was having this expression like, and once I pushed it, he was like, ha. He was like, okay, the magnet hasn't moved. And I was thinking, why are you so scared? I mean, I was very confident with that because of the cardiac surgery. So everyone, I'm just trying to say here is everyone has their pros and cons. Everyone has their confident sides and less sides. What can you do in that case? Work more on the parts that you don't feel confident. The confident ones, though, you will anyways do. You're very confident in knowledge. It's okay. Work more on the skills, but you have to work. You cannot just keep asking other people that how did you do your skills? Give me some tips. Yeah, you ask once, but then do it. Do it with someone. You have to do it. Unless and until you do it, you won't understand how you're doing in it. That's it. Sorry
Yeah.
for the long
Okay, so we're
long
going to
speech.
take the question from Dr. Farhan. Dr. Farhan, you have raised your hand. I can see.
Yes, sir. First
Mhm.
of all, many congratulations to all the candidates who have already passed. And I want to say that I have my exam just after 21st of January in Hyderabad. So in the last, I'm in the last phase of my preparation and I'm like panicking like anything, like what to do and what not to revise. So I just want to ask Dr. Sanika what to revise and how not to panic in the last 2 days or 3 days of the exam.
So
And
last,
I'm fearing the most about the communication and history stations.
hmm.
That how will I
So
perform?
do you have someone with whom you can practice?
Yeah, I had practiced the skills stations with my partner,
But
but
right now,
I just right now I have a stop right now. Just 2 days it's left, so
hmm.
I'm just revising my things. I just want to know how to summarize because I sometimes feel I will get stuck in summarizing my examination station because in the practice we don't get any real patient or any like I'm practicing with my partner, so
Hmm.
there is no diabetic foot or anything ulcer or anything like that. So whatever the positive finding on the spot I will get. So I think I may get stuck in that summary. And how is that summary important in marking the exam?
So it's
Because I know I can be in the flow during performing, like how to examine the diabetic foot, but maybe I get stuck during presentation.
hmm.
Like what positive finding I got in those 6 minutes. So that's what I am fearing the most, the presentation part. In the
Mhm.
examination also and in the history also, the presentation part. Because I had practiced that, what I have to do in those 6 minutes, but the positive findings, what I get in the history or examination, I fear that the most. So the
Dr. Farhan,
summary, yes, sir.
okay, I'm giving you a scenario. Okay, you do your examination of the diabetic foot. You enter into the station. You just check a look of the patient. Okay, there wasn't any problem with the patient gait, and also the patient doesn't have any walking aids, nothing else, right? So you just take a look of the patient was walking and all that stuff, and then you start examining the patient. You were checking, and maybe there's some ulcer, okay, on the right side of the patient foot. Okay, and you just check about the patient of the patient foot for the, if you want, you can check about the joints. It's fine. And for the neurological examination, you went for the top curves, and there is nothing abnormalities was detected, and only there is some sensation loss on the right side of the patient foot, and also the proprioception of the vibration sensors was lost on the right side. Okay, now present your case.
Today I examined this gentleman presented with numbness in his right foot. On general inspection, I did not notice any change in the gait. On inspection of the foot, I noticed an ulcer present in the sole of the foot, and some sensation was lost over the dorsum of the foot, and also there was vibration and proprioception was also normal. So
Wasn't
and
normal, it
also,
was lost.
but okay, yeah, it was lost. And on checking the sensation, there was some loss of sensation on light touch over the dorsum of the foot. So my main differential would be diabetic foot in the right side.
Okay. So now see, you are going to
I
say you are going to say only the positive findings that you are going to find. Okay. So now you started with the inspection. I inspected the patient and I couldn't see any abnormalities in the inspection. It is an unnecessary statement that you are going to give, right?
Yes, sir.
No need. So what you have to do is simply go for the positive findings and go for your diagnosis, and that's it. You are going to have the marks.
Just the only the positive findings.
Only the
Would
positive findings. That what I was thinking. That you were going through the notes and you were thinking how I can memorize all of this presentation, that the presentation, there are lots of things in the clinical examination and also in the history taking part, correct?
Yes, sir.
Exactly. Just forget about these things. No need. No need to go for those things at all. Okay. Those are given just to have your idea. Okay. What could be the patient and what could be your type of presentation you can give in your exam. But for your exam, just go for your own positive findings, whatever you are going to have in your exam. Mention those 2-3 points, maximum 4 points you're going to have in your exam. Okay. And give your diagnosis, and that's it.
Okay. So that would be just 3 to 4
It
lines, I think.
Exactly. So today I have been examining this patient who is, maybe the name of the patient is Robert. So today I've been examining the patient Robert, who is 60 years old, and there is a numbness on the right side of the patient foot, and there is some presence of ulcer, and also the on examination of the vibration and the proprioception, it was lost. So based on that, my provisional diagnosis is peripheral neuropathy for this patient because of diabetes mellitus. That's it. That's all you need to say, and move on for the next question. It is that much easy.
Okay. Okay, sir.
Relieved?
Okay. Okay. Yes, sir. I'm
Good.
really tensed about this summary
Don't.
part.
Don't. Okay. All right. Dr. Sanagi, you wanted to say something, I guess.
Me?
Yes, because Dr.
Uh-huh.
Farhan asked the question to you.
See, Dr. Farhan,
How did you manage that summary part? Yes.
so in my 2 stations, actually, only the stem had the findings. 2 out of 3, the stem had the findings. The patient did not have. The stem said that the patient has ulcer, but patient did not have ulcer. So I was very lost there. But then you have to say the truth, right? You cannot just make it up. So I told them that I had no significant findings, and whatever I did, I told them that I have done this special test, that special test. So there was nothing specific, but according to the STEM, while if I'm going to consider my STEM, then I would like to consider my differential diagnosis as this. And he was quite happy with that. He was okay. So don't worry about the findings. That is not something you have to be worried about. You have to be focused upon how your flow is going to be once you enter the station. You have to just focus on that. Everything else will fall into place. So don't worry. Don't worry at all. It's just something that you have done on a daily basis. Just go and you'll be fine.
Okay. Okay, thank
Yeah.
you.
All right. Anyone else wants to ask any questions, please?
Sir,
Yes.
sir, there is a request from you. If possible, sir, can you arrange some mocks for us? If possible, I know you must be so busy with your course, but it's still, if it's possible.
In the free group?
Yeah, if it's possible for you, sir.
Yes, yes, definitely. I will do that. No problem.
Thank you, sir. Thank you.
All right. Okay. All right. Thank you, Dr. Sanika, for being within us and share your experience with us. Inshallah, we will be doing great things in the future. And I have added you into the Hall of Fame of IMG. Good luck with that, and get your GMC and all that stuff. And thank you. And I'm really, really happy for all of you. Okay. Thank you, Dr. Sanika.
Thank you
you
for
so
having
much.
me.
Yeah. All right.